Well, let's get started. Well, thank you for joining me today. I'm really glad that we got a time that we can sit and chat together. So thank you for setting aside this time to meet with me.
Yeah, thanks for having me.
Of course. As an introduction, my name is Jazel. If you don't know yet, I know you know Gwen, but for those listening on Facebook Live or in the pre-recording, my name is Jazel Tricia. I'm a certified fitness expert. My goal is to help people find joy through movement, connect with their bodies, increase their energy, and build a strong mind, body, and soul. I offer virtual training sessions and customized fitness programs with a holistic approach that helps people transform from the inside out, mentally and physically. So a little background on Gwen. She's actually my aunt, like my mom's cousin by marriage.
Yeah.
But she has been a physical therapist for the past 16 years and has a BS in psychobiology, which I'm not all too familiar with. So I would love if you can talk about that, and also just like your background as a PT.
Sure. So first of all, thank you for having me, and I'm so proud of you for what you are offering to people and just the platform that you have to talk about wellness and health. I think it's so important these days that there is that discussion, because that is a big part of your health is the whole body and well-being. But yeah, I'm Gwen Nable. So my bachelor's is in psychobiology. So when I was going to UCLA, I was a biology major, but I just found the science classes to be very boring and very difficult.
Yeah.
So when I started taking psychology classes, I just really found an interest in that. And so I said, why don't I just combine it and study psychology and biology? And basically it's just the biology of how psychology works. So basically it's the scientific way of how behavior works, or how we behave.
Yeah.
It's a lot of neuroscience. It's a lot of studying the brain and just scientifically how our brain controls our behavior and everything else that goes along with it.
Yeah.
So that was interesting. And what led me to be a PT was just that after I graduated, I just didn't really know exactly what I wanted to do. I knew I wanted to be in a field that helped people, and I enjoyed the medical field. I thought I wanted to be a doctor, an MD. But then I wasn't very sure, because I wasn't sure if I wanted to commit that time to med school and studying for the MCAT.
Yeah.
So instead I just worked in different medical facilities, and I looked at what everyone did, and I talked to everyone in different professions. So the medical doctors, the nurses, everything I watched, I observed. And I just saw the PTs, and I just saw how happy they were, and just how the patients just really appreciated them. Working in a hospital, basically they were just trying to get them to be strong enough to go home. And I thought that was awesome to be part of that. And just everything about the profession I thought was for me. It was like their work schedules, the satisfaction you have of seeing patients get better quickly.
Yeah.
So
higher, what do you call it? Satisfaction, like rating with physical therapists is what I've seen as well.
Oh yeah, it's almost like you see quick rewards, like in a few weeks from them laying in the bed weak, and then in a few weeks to them being able to walk and go home. It's just really nice to see that when you're in the hospital.
Yeah.
So then I applied to PT school. I went for 3 years. I went to USC, graduated in 2004 with the DPT, and I worked from acute rehab to in the hospital with orthopedic surgery patients. I worked in the hospital for a while, and then now I'm in outpatient and I work with veterans. So
awesome. So I love that you really found something that you were really interested in, still going into like the medical field and like helping people. Um, so I would love to kind of get to know. I know that you've talked about like your whole like mind body perspective. I love if you can kind of let us know like what your take on that is, and describe a little bit like what really is like the connection between like the mind and the body.
So it's interesting because in PT school, you learn a lot about evidence-based practice. And basically, it means that they do extensive research scientifically on methods to help patients. And basically, they believe in if there is no evidence done by a study of researchers,
Mm-hmm.
essentially it's not effective, so don't use it. I mean, that's the gist of what we learn in PT school.
Mm-hmm.
And as time went on and I started to practice and I tried to stick with that, I realized that a lot of the patients cannot just be treated like that effectively. I mean, just personally, because I know a lot of PTs may not agree with that.
Yeah.
But I noticed that there is a very strong component of patients' emotionally and mental well-being um, also affected. That also affects what they're going through as far as pain or inability to move.
Yeah.
And so once I started, and it took a while, you know, as practice, and you go on and you see a lot of patients and you meet a lot of people and you end up talking to them and learning about them as people, you start realizing you have to really treat each person as a person, not a body part. You can't treat a person that comes in with knee pain, every knee pain is going to be the same and this is what you do. It just doesn't work out like that. You need to evaluate the person as a whole, and based on that, figure out how is this person being affected and how am I going to treat them. And I learned that because I have worked with veterans for a long time, a lot of people, part of the component of what they're going through is something emotionally or something in their mental health that may not be connected. And
Mm-hmm.
so although I still do use evidence-based practice, I also want to use what I learned just through life on how to treat them. So it's a very important thing as practitioners to make sure that we know that you treat the person as a whole and not just as a body part.
Yeah. Well, when you say, I guess like assessing them like as a whole, um, uh, I know that there's always like the physical assessments of it, and like knowing what their range of motion is and like what their strength is. How would you take, I guess, like them as a whole, and assess that? Are there certain like questions in their background that you ask, like in terms of like their experience, or how do you, I guess, like assess like being able to relate like what they're going through with their physical pain?
Yes. Mm-hmm. And that's basically, I believe that's what a good practitioner does, that you do have to assess everything in your own way, so you can effectively treat them, and also so they know that you care, you know, because sometimes when patients don't feel that connection or they don't feel that you care, that you're listening, that also does affect their treatment.
Mm. Um, how do you feel like it affects like their treatment?
um, a lot of times patients they'll have a long story of how they got there, you know, so
Mm.
depending on what their main reason for coming in, they
Yeah.
may have this story that, you know, and something about that story kind of gives me a red flag and I'll go back into that. And um it kind of helps me guide their treatment. And some things, I think it's hard to explain. So let me try to give an example.
Okay.
Sometimes patients will come in and they'll say, I have this major back pain, you know, and then they'll say, you know, I work out all the time, I do this, I do that, and I just don't know, I'm so strong, I don't know how I could get this back pain.
Yeah.
And then somehow along while we're talking, they say, I'm a full-time caregiver for my 95-year-old mother. And I say, oh, okay, tell me more about that.
Yeah.
Oh, it's really hard. I have to lift her in and out of bed all the time. And, you know, I don't get time for myself. And it's kind of like then this mental health component comes in. Well, how do you feel about that? And come to find out that maybe that's draining them. Maybe they don't have enough time to take care of themselves. Maybe they're doing the wrong body mechanics when they're lifting her out of bed. You know, something they're doing repetitively that's causing their pain. And then we go into, that's how we start treating the problem, you know, and we start talking about that. And well, maybe if you take breaks sometimes, or maybe if you carry your mother in this way instead, or maybe get help. And so those are like little ways you can kind of bring in the mental health part of their treatment or their healing process.
Yeah. Awesome. I was wondering that, I guess, like with that, what are some of the most common like issues that people go to you for, or what are the issues that you see most commonly in?
Most commonly, I would have to say low back pain and shoulder pain.
Yeah.
Yeah, I mean, part of it too is just because I do work with veterans, so they many of them had issues in the military from carrying a lot of heavy equipment, and all their training, or they must have been injured in the services, and a lot of that heavy training and heavy carrying has affected their shoulder, back, or they did get injured at that time, and then years to come later they're having major problems. So, but shoulder and back pain. Definitely. Yeah.
And I know that, like, yeah, I feel like just like the general population, like they all have like some, but it's either one, the other, or like both, and like
Yeah.
so those are definitely like a high pain points for a lot of people.
Yes.
With those types of pain, like what are the, I guess, like the treatments that you would give to help someone with those two?
I think most importantly, probably something that everybody should be aware of, it is posture. I think a lot of people, even before I went to PT school, I didn't understand what that meant, you know, posture. But it's like using the right muscles at the right time, and body mechanics.
Yeah.
The basic things that, because a lot of times I start with the basics of just educating, well, these are your muscles and this is what they do, and these are the muscles that should be working to do that.
Mm-hmm.
And they're just like, wow, I just never thought about that, you know. Just no one ever told me that. Nobody ever told me you're like, you know, like I would say something like, you know, to protect your back is actually not really your back muscles, it's your abdominals. They're just like, wow, no one ever told me that. I've been using my back muscles this whole time, and that's probably why it hurts. And it's like, yeah, it is it has to come from your core, your abdominals, and you have to watch the way you're doing things, because if you keep doing them wrong, that's how people get pain. And it could be so simple as just reaching your phone in bed like this over and over again. That can cause shoulder pain, you know. Little things that people don't realize they're doing repetitively that can cause pain later.
Yeah. I always like to say that in my, for the people that take my classes, is that there's always conscious movement and there's subconscious movement. And the idea of, like, you know, taking a workout class or like a training session is that where you're taking that hour to exercise and to know like functional like movement, and know what muscles are activating like for that movement in a conscious way. So you spend that hour like really like thinking about it, so that way when you go out into your daily life, it'll kind of like retrain your mind and your body to be able to do it subconsciously, so you don't have to be thinking about that every single time like you're lifting your arm, or that when you're bending over, that you're not using like the wrong like muscle groups to do that movement.
Right, exactly. And that's exactly what you said, and that's kind of the idea of mind body. It is connecting the mind with the body, meaning like scientifically your brain is making new connections scientifically, the neuroplasticity or the nerves connecting, so that your brain does get used to that movement, and then it becomes more automatic. It's through practice. It's scientifically proven. The more you practice, the more you're aware, it does end up connecting more neurons in your brain, so that you know how to do that better, and it becomes just a normal behavior after a while. So you're right, definitely.
Yeah, it's like I always feel like there's like this whole like disconnect with like with people's physical skills and then people's mental skills. But it's almost like you can't, you're one whole body, and it's all like ingrained in each other. You can't even move your muscles without your mind being able to like you said, like fire up those like neurons and like make those like specific pathways to activate your muscles. It's really like all like your entire body. So I feel like we have to start like educating people on that is like just like one thing, like your mind and your body work together.
Yes.
Yeah. I was wondering if you can tell us about the types of methods that you use in your practice. I know a little bit about like PT and doing like manual treatment, or if you use like certain like apparatuses. What can you tell me like what it is that you use with your patients, and what you kind of like specialize in?
Sure. The patients I've seen go anywhere from orthopedic, they've had surgery like a joint replacement, to neurological stroke, Parkinson's disease. So I tried to use anything that I learned, which is, I try to use a lot of manual therapy. And manual therapy could be anything from just joint mobilization to get more range of motion. Let's say if you can't raise your arm very hard, I move the joint. Or soft tissue work. People call it massage, but it's really just learning how to work with the different layers of tissue and using that for either pain, swelling, or range of motion. I use a lot of Neuro Techniques because when I got out of school, I really enjoyed working with the patients that had strokes. And that's what I did for a while in the hospital. And that's really where the psychobiology came into play, because that's really trying to use techniques, exercise functionally to connect those muscles back to the brain where they may have gotten lost from the stroke. And that's really fun. It's very fun to do Neuro Techniques because you see rewards very quickly a lot of times.
What are the Neuro Techniques? Or can you explain, I guess, like some of the Neuro Techniques that...
So basically, to sum it up, it's like functional exercise. So let's say for an orthopedic shoulder, you say, okay, well, let's do 5 5 or 10 reps of bicep curls, and that's how we're going to exercise, and this is what you're going to do every day.
Mm-hmm.
With patients that have a neurological deficit, something happened in their brain or their nervous system that got disconnected. And basically, you're trying to retrain the body to make that connection again. So from just simply from like sitting to standing, they have to learn how to do that again.
Oh.
They knew how to do that, but now their muscles don't work the same way. So it sounds, even in school, we kind of made fun of it. Oh, it's the sit to stand class. But basically, you're going over in repetition something functional that seems easy to you, but sitting to standing. So you watch them, and they use their strong side to get up. So let's say their weak side is not working, and they keep using their strong side, and you say, no, I'm going to force you to use the weak side so we can connect those muscles that don't know how to work. We're going to make them work again by forcing you to use those muscles. And that connection is going to go back to your brain and say, I have those muscles, I just have to learn how to use them again. And that's the kind of the gist of neuro. So it's very, you have to be kind of creative in your treatment. It's not like a simple orthopedic treatment where, like I said, it's like 10 reps of raising, but it's like, let's practice throwing the ball. Let's practice reaching up in the cupboard and get that plate up there. Let's do functional things that you thought you couldn't do anymore, but this is going to be your exercise. And you can think of anything, any kind of exercise, as a therapist. It's fun because you get to just create whatever you want to,
Just for them to like relearn like those movements and like those just like daily physical skills.
Right. And yeah, it's because basically you're trying to get them to learn just their daily, activities of daily living, like getting them to brush their teeth again, or dress themselves, or again go to the toilet. Those things we take for granted, but once you have something happen to you and you can't do it, the therapist is like the coach to say, this is the muscles you need to use. I'm going to force you to do that, and your brain is going to start getting to know that's how you do it.
Mm-hmm. Well, when it comes to those types of patients, is well, I know there's like the disconnect from them being able to do those activities, but are they feeling pain when they do them? And
sometimes they do, yeah.
I always feel like it's interesting, like, because no one's, it's very rare to come across people who have like zero pain, and there's always like that scale of like, well, when should I still be moving even though I have this pain, or how do I know when to stop doing that? Because you don't want to continue doing things and avoid the pain and start to compensate with other things, but it's I feel like as a trainer, it's hard for me to like know like what my clients are feeling and how to gauge when it's relatively safe for them to do that exercise, and when it's too much.
Right. That's a really good question. It depends. In general, I don't like my patients to exercise through pain, and it depends. So that's why it's kind of hard to answer, but it depends, because if you know what muscle you're targeting or what your goal is, you should know which muscles are going to cause pain. Pain, though, should be just some muscle soreness. So let's say I do like 100 crunches and my abs are kind of sore. Well, yeah, that's the muscles we're supposed to, but let's say you do 100 crunches and my back hurts. Well, your back shouldn't hurt if you're doing it correctly. So those are the things that you need to watch out for, because you know the muscles that should be sore. And if something else is causing soreness, then you know that they are overcompensating, because that's not the muscle we're exercising.
I
A
see.
lot of things, a lot of times it helps if you really go into, if you really educate them on that muscle and sometimes show them pictures and say, this is the muscle that, so when they're doing the exercise, they can visualize, okay, I'm working my six pack. I'm not working my, you know,
Like that.
my quad, I mean, my lumbar area or my, you know what I mean? Like,
Mhm.
um, so, but in general, if it's really causing too much pain, where it gets them, it affects them the next 1 or 2 days to a point they can't do their regular activities. Maybe it's too much, you know.
Yeah. And you just have to like scale it like as is, because you don't want to be like working some other area and causing pain in another area.
Right? Yeah.
It should be like, if they were doing it correctly, should be targeting like that, the muscle group of focus.
Right.
Yeah. Awesome. I was wondering if you can kind of, I know that you've mentioned integrating healing touch in your practice. I was wondering if you can kind of talk about that, like what it is, like what is actually like happening when to the body, or like in this type of treatment.
So yeah, I was lucky to get the opportunity to learn what's called healing touch at my workplace. They offered it through a practitioner, a certified practitioner who is also a nurse by background,
Mm-hmm.
and it is evidence-based healing
Mm-hmm.
through someone that was a physicist and also a nurse. And it's similar to Reiki, but the reason why they don't use Reiki per se is because sometimes they think of Reiki as a like a religious or spiritual connection,
Mm-hmm.
and a lot of patients don't like that because if they don't have
Yeah.
that as part of their lifestyle, they get kind of scared by it.
Mm-hmm.
But basically, healing touch is a form of energy healing, and the concept is that we all are a ball of energy. Everybody that's living, us as people, we have energy. Biologically, scientifically, we have energy.
Mm-hmm.
And through our energy, we are able to transfer energy to other people. So the interesting part of healing touch is that you don't actually touch the patient. It's a transfer of energy without touch. So I know it sounds, it's kind of hard to explain, but for example, what they say is whatever your issues are, where you need healing,
Mm-hmm.
healing touch may be able to help. So
Mm-hmm.
anyone can come in and say, I have shoulder pain, or say, you know, I'm going through a really hard time, I feel a little depressed, and say, well, let's try healing touch. And
Mm-hmm.
it's a way of using your hands, and your hands have energy, um, to lightly go over the body
Mm-hmm.
and transfer energy in a way that heals them. So it's almost like you're pushing energy away to heal whatever needs to be healed. Some people don't believe in it, and I totally respect that, but some people love it and really feel that it helps, you know. And um, I use that sometimes. I don't use that all the time. I only use it if I feel like it'll be beneficial for the patient. But
Mm-hmm.
sometimes when I use the technique and I do my assessment, what I feel as a practitioner, everybody's kind of different,
Mm-hmm.
is that I feel heat. So if a patient is just lying down and resting and they say, you know, please assess, you know, where I have issues, I
Mm-hmm.
can feel that it feels hotter in a certain area where they have issues
Ah.
versus where they don't. Other people feel other things, and then some of the techniques are just transferring the energy away that helps with healing. That's a
Yeah.
general way of explaining it.
That's so interesting, because am like really interested in this whole healing touch, because I was watching, was Gwyneth Paltrow's show Goop,
Uh-huh.
and she was talking with a chiropractor that also does um, energy work, and basically he has people like laying on the tables, and he explains as like activating some sort of like energy field from away from the body, and there's certain like, I guess like distances or like ways to get in touch with like the energy of that person. And I just thought it was like really fascinating that there are actually like more studies about this, and that it's actually being used in the medical field like as treatment, because it's one of those things where it's like, okay, I can't see it, like it's not like a, like, you know, you can't like physically see it, but if there's, you know, as you said, it's evidence-based, that, you know, I mean, obviously there's the things that we can see in science, but, you know, there's also air, and we believe that there's air, but we can't see it. So there is actually like energy. I don't know if you can say it's like forces, or like just like energy,
A transfer
like
of energy.
the transfer of energy with our bodies, and that we're like actually moving this energy like everywhere we go. I think that's like super fascinating.
I believe in that. I totally believe it.
Do you think with people that don't believe in it, that it like doesn't, or like it wouldn't work for them because they that they wouldn't be able to, like, I guess, receive that type of like healing?
Yes, yeah. I think if for people that don't believe in it, it may not be effective because they may not because they don't believe it's effective. Part of that is maybe blocking some of that energy. So it's not for everyone, but there have been people that were very skeptical, and then they had the treatment and they believed in it after.
Yeah.
But you know, but some people it doesn't work for them, and I understand. Not everything works for everybody.
Yeah.
And some people are also more sensitive to energies than other people. You know, some people are able to feel a certain energy coming from somebody else, and some people, they just don't feel that, and that's okay.
Yeah. I've been kind of looking more into like this concept of how people can almost like self-heal themselves, at least. So with the John Amaro, I think I'm pronouncing it right, he has this 7-day fight or flight challenge, to where he kind of teaches you to have like how to activate like your own energy using like your own hands, and knowing how to kind of like push that energy out, or push out like negative energy from like your own body. So I've been kind of really interested in this idea of self-healing, or like people's ability to be able to like heal themselves, whether it's through like energy work, or through like meditation, because I've been reading a lot of books lately, or excuse me, listening to a lot of motivational, like books on like motivation, and how powerful like your mind is. And one of the things that I read was that this lady was able to like heal herself from cancer just from being like so spending a lot of like mental work and meditation to, in a sense, like, I guess like change her physical chemistry through that. I was wondering like what your perspective on that is, and like how impactful is like that whole like mind to body connection, to be able to change that on a physical in the physical perspective.
I agree with that. I the mind has a lot to do with how people function and how people feel, and um just scientifically, when people undergo a lot of stress in their lives, there is a scientific chemical reaction that happens where cortisol is released as stress hormones, and that lowers your immune system. For some people, that causes migraines. For some people, that causes neck pain. For some people, so there are scientific biological things that happen to your body from stress. So even though some people, they say, well, stress is such a, anything can be stress. There could be positive stress, there could be negative stress, but things do happen to your body when you undergo stress. And when your immune system goes down, there is more vulnerability of the body to get, sick. And so now I'm not saying that, you know, you have cancer and you start doing energy healing and everyone's going to be better. I mean, let's be realistic, I mean, but definitely mind, body, and staying spiritual, trying to stay positive, healing yourself as a person, being aware, doing things you enjoy, all of that does help with your immune system and helping bring your stress levels down. So it definitely helps.
Yeah. I was wondering, what are some of the kind of like self-care or like self-healing practices that you do personally?
What you gave me that question of the 3 best tips for healthy mind, body, and spirit, and I was thinking that's a really good question. That's something and that I've learned just from experience and looking at myself and how I do things. But I think the number one thing is to love yourself.
Yeah.
I think that people, when you hear that, you kind of think, well, that's kind of strange. But a lot of times people don't realize that the way you treat other people that you love, you love them so much, you care about them so much, you want to do so much for them. You should do that for yourself. You should feel that way for yourself. You should treat yourself and love yourself the way you love other people. So that means you want to take care of yourself. You want to do things that make you happy. You don't want to compare yourself to other people. You want to accept yourself for who you are. These are my strengths. These are my weaknesses. And that's okay. I'm not going to be perfect. You don't have to be perfect, and I think that's a struggle a lot of people have, and maybe can go back to way years of whatever happened in their life. But I think once you start to learn how to love yourself and accept yourself for who you are and the strengths you have, that's the first thing you need to be a healthy person. Because after that, whatever happens, it's okay. You know what I mean? Like,
Yeah.
I love myself and I'm good at this, and maybe that person's good at that, but that's okay. I don't have to be like that person.
Yeah.
And that's the other thing, is you have to schedule time to take care of yourself, because people get so busy and they just, and I'm guilty of it too. This is what I try to do. It's not like I do this. This is what I'm still actively trying to do, but to schedule time for yourself. So like, maybe once every month, schedule a time to get a massage, schedule time to get your nails done, or something for yourself that only you do for yourself. That's healthy, of course.
Yeah, of course.
And then the other thing is, if you're going to exercise, if you want to exercise, make sure you do something you enjoy, whether that's gardening, dancing, whatever it is that you like to do, make it an activity that's fun. Because if you force yourself to do something you don't like, it's not going to be fun, and you're probably not going to do it.
And you're not going to be doing it for very long, because after a certain point, it's like, well, do I really like doing this?
Yeah, and then you're gonna connect the exercise with negativity, like it's not fun, or you don't want to do it anymore. So make sure if it's whatever you're doing as activity, you enjoy it, and there was gonna be something else I was gonna say, and I just completely
It's
forgot.
okay. I love that, like, you know, that your number one, like, advice is really just like loving yourself, because I mean, that's one of the things that, like, I focus on with my fitness program. And uh, I have a mindset, like, aspect to my fitness program. Like, it's not just like the exercise, it's the fitness aspect, the nutrition aspect, but also like the mindset aspect. So when I take people through my program, I encourage them to at least set aside 10 minutes of self-care every day. And like,
Mhm.
that self-care is like, can be anything, just like sitting in a room, like by yourself, um, either meditating, journaling, listening to music that you enjoy. But whatever it is that, like, you choose, you take just 10 minutes out of your day to learn how to, like, fill yourself with energy, or like do something that, like, fulfills you and that helps you recover, and to learn how to use that time to love yourself,
Mhm.
because it's being able to remember the value that you have as a person. And if you value yourself and if you respect yourself, then you'd be able to know that you are worth spending that hour of working out, because you have to be able to take the time to improve, you know, your body and your mind, and just managing, like, your emotions with that. Because I think the mindset and the motivational aspect is really vital in a person's, like, progress, and a person's I don't know what's the word I'm looking for, just like drive to want to change, or
Mhm.
want to improve, like, their lives. So that
Exactly.
really is just like a huge part, just like learning how to love yourself and to respect
Exactly.
yourself.
Exactly.
Yeah.
And honestly, these are things I learned recently. It's not like I knew this all my life, or it's something that I still try to learn about, and try, like I said, to practice now. And like things like breathing. I never really learned the value of breathing correctly through your lungs, and really being aware of that breath, and things like that. Meditation. Those are things you have to practice. I mean, it's not easy to focus on, especially if your mind is all the time thinking of this and what I have to do and stuff. It's very, it takes a lot of practice to meditate, and to really, it takes practice to take care of yourself. I know that sounds weird
It
to say,
really
but
does.
it's like, it
Yeah.
takes work, but you should be doing that,
I think just with the whole, like, staying at home, it has really almost like forced people to reevaluate their themselves, and like what they value, uh, and uh, how to distribute, like, their time and energy in the things that they do. But I feel like it's really put an importance on mental health,
Yes.
um, well, mental and physical health, because, you know, you're sitting at home all day, and you're kind of just like either like stuck by yourselves at home, or and just like really like living in solitude, and feeling a
Mhm.
lot of like feelings of like depression and loneliness and disconnect. But there's also people who, like you, living at home with your entire family and having to balance, like, you know, the kids, cleaning, like your own work, because you still like have work at home, and just trying to keep everyone safe and keep everyone sane,
Right.
especially like for yourself. So it really is like just like an important time to know that you have to have that self-care time,
Mm-hmm.
and knowing what it is that you have to do to, in a way, like regenerate yourself,
Mm-hmm.
whether it's like
Exactly.
making a time to actually go to sleep and get a good solid rest at night, which I
Yeah.
feel like is really hard for a lot of people.
Yeah, it
To
is. It
get
is.
quality sleep. I feel like we're just like living in a world where it's so common to not sleep or
Yes.
to like work like until 3 or 4 in the morning. So it really is just like super important for us in this time to make sure that we're taking care of ourselves.
Exactly.
Yeah. I was wondering if you can let people know about like how it is that you as a physical therapist are still continuing your practice today.
um, well, I don't have my own practice. I don't work for private practice. I work um, for the government. So we don't have a choice. We have to go to work.
Oh,
Um,
like in the like physically at work.
yes, I've been physically going to work. And 2 weeks into quarantine, we stopped seeing patients physically. So we were doing telehealth at work. I was still going to work. We were doing telehealth. So we were doing phone visits and
Hmm.
video visits, which, presents its own challenge because some things are better done in person as a therapist, but
Yeah.
also you don't want to put people and yourself at risk as physical therapists, we have to be very close to the patients.
Hmm.
Um, and so we wanted to be careful about that. And then the times that we weren't seeing patients, we were helping around the clinic to screen patients from coming into the clinic and things like that.
Hmm.
So they found ways for us to still be helpful when not seeing patients. Um, but I found that doing telehealth for the patients, a lot of them just appreciate me checking on them because a lot of them live alone.
Hmm.
A lot of them don't have a lot of social support. So just calling and checking to see how they're doing, even though we're talking about physical therapy or whatever the reason is they went to physical therapy,
Hmm.
they just want to know that someone cares about them. I have a 97-year-old
Oh,
veteran patient who lives alone. I mean,
oh
he
man.
does everything on his own, and he just likes talking to me because I see how he's doing,
Oh,
but it's been challenging. But I think just checking in on people and the video, being able to watch them do the exercise is helpful for them.
yeah.
Um, so that's helped, but we do have our challenges,
Yeah.
w-
I was wondering with the whole like telehealth and having to like see people um, like through video chat or however it is that you meet with them. Um, how does like that session go if like they kind of like need to be doing something on a physical manner? Do you kind of just like guide them through exercises? Because you obviously don't have like um, all of the equipment or the tools that you would have in a normal session.
Right. Yeah. So I just if they have video, because some of them don't, but if they have the video, I watch them do the exercise, and I try to correct them if I can. Obviously it's better to try to correct them in person where you could put their hands on them and
Yeah.
but and then I've been just emailing exercises they can do. Sometimes I'll send them a YouTube link, which one of the patients, he has Parkinson's disease, and
Mm.
his caregiver loved the YouTube video I sent, which was just like basically almost like a dance routine, but both of them did it and they just loved it. So some of them it's very helpful because they don't want to leave the house and they want
Yeah.
to be able to do stuff that's fun at their house.
Hmm.
Um, so that's been helpful for some of them. It's that it's better to see them in clinic, but just right now it's not the right time. So
Yeah.
hopefully this all ends soon and we can go back to normal lives.
I know. Hopefully sooner rather than later, but
Yeah.
it's awesome that you're still like able to to work with people and like help them out, whether it is taking them through exercises or just like catching up with them. I think that's really important to know that that we still have people like you who are able to like reach out to them and still show that they care for them. In terms of injury prevention and chronic pain prevention, what would you say are your 3 best tips for that?
Body mechanics for sure, you know, just making sure that you don't lift things with your back, you know, make sure that you keep your core strong and use your legs. Body mechanics is also far as just even when you're reaching for something, you want to make sure you're not reaching too far because that's also going to affect your back. You want to make sure you walk up to it, then you pick it up, and you're always thinking about your core and your legs and your glutes to do the work. Another thing is, it's kind of a joke, but it's like work smarter, not harder.
Yeah.
You know, like one of my patients who was young, he was having a shoulder pain, and I said, well, what do you do for work? And he's like, well, I just have a sitting job. You know, I just have a sitting job. I don't do anything crazy. I don't, I don't lift anything. I just, I just sit at a job. And he said, I sit at a computer and I take papers. And I said, well, what is the setup of your computer station? What are you doing every day? And he's like, well, I said, show me, So he said, well, I'm here at my computer and I have to get paper. And I was like, okay, is the paper heavy? He's like, no, it's not heavy. Well, I have to get, I have to grab paper and I have to put it down on my desk. I said, how many times do you do it? He's like, pretty much all day. I was like, well, where's the printer? Well, the printer's all the way up here. And so I was like, so you're basically typing and all day you're doing this. You're doing this all day. Like, it's like you're exercising like this all day. And you're asking why your shoulder hurts. Maybe, can you just maybe bring the printer so you just have to like work from here? Mm-hmm. And then his shoulder pain was better. It's like sometimes it's reevaluating what you do every day, mm-hmm. repetitively, and then say, oh, maybe I should just move the printer and move this so that I have to just work from here instead of working in these awkward positions. Mm-hmm. And then that sometimes solves the problem. You just reevaluated what you're doing, and then you identified it. Oh, okay, I'm overusing this muscle because it's just set up wrong,
Work smarter, not harder.
Yeah, especially looking at what you do every day. It's usually the workplace, or oh my gosh, my arm. It's like, well, are you on your phone all day doing this? And it's like, well, that's why your wrist is hurting, or because you're like, or your neck is hurting because you're like this on your iPhone all day and text, things like that, so yeah. Those are things people should be reevaluating when they're having pain. Like, when is it that I have that pain and what am I doing and how can I make that easier?
Yeah. It's like, are there like certain questions that you always like ask people to be able to recognize that? Because we go through like a lot of our days moving our bodies. It's not really being fully aware of what we do physically. So when you're meeting with clients or with the patients, do you have them kind of like write down like the most common activities that they have, or do you kind of just like talk them through it?
Yeah, I just say, well, how did it happen? If they're coming in for whatever pain, I say, how did it happen? Sometimes it is an injury. I got into a car accident, or I twisted. I was playing football, whatever. So sometimes they know. But if it's something like, I don't know, I work out all the time. That's another thing. It's like, I go to the gym well, look at how you're working out. How are you working out? What are you doing? what movement are you doing that's causing the pain? You know, it's like, well, I could do squats, that's fine, but every time I do, you know, crunches, then my back hurts. I think that's another thing, especially with back pain. It's really explaining how important the core is. The core, this abdominal muscles are layers and they're big muscles. They are protecting the spine from the front. That's how people should be thinking of supporting the spine, through the abdominals, not through your paraspinals, not through your little back muscles in the back. Those are not the ones that are, it's your core, it's the front.
Yeah.
And I think once you teach people how to activate those abdominals and deactivate the back muscles when they're doing activities, that's very helpful for them to visualize, like, oh, okay, so I am supposed to be using these muscles and not the back muscles.
Yeah. I feel like there's always like this huge issue when it comes to awareness, like people's awareness with their bodies.
Yeah.
Are there certain like exercises that you encourage your patients to do to increase like their physical awareness?
Especially with back problems, I always go down to the basics of education on that, like your core muscles, your abdominals, your glutes, and I make them activate it, just that. No other, I don't have them do planks, or I say, see this muscle, your transverse abdominis, your deep abdominal muscle, you're going to use that. And a lot of people, they don't know how to do that. You have to train them how to do that, because they are always thinking about their six pack, their abdominis rectus. Yeah, the six pack. But there's abdominal muscles deep inside the transverse abdominis, which is deep in there. And that's in the front of your spine. And that is the muscle I always have to teach them. That is the muscle that's going to protect your spine from the front. And I always say, it's that muscle that if I was going to punch you in the stomach really hard and you tightened it so it's flat as a board and I can't hurt you, it's that muscle. And even if I say that, it's still hard for people to act. So you have to actually feel it and say, okay, you got it. Practice that every day. And you're going to practice that every day. And when you get it, then I'm going to progress your exercise to the next one and the next one, because every core exercise is going to involve that muscle. So here comes Mia.
Yes, I always talk about the transverse abdominis. Hi, Mia. Hello, welcome to the show.
You're gonna gotta be quiet, and you're gonna be the audience, because we're giving a class.
Well, I really appreciate you taking the time to talk to me, and it's awesome just kind of like getting to know your work and like seeing what you've been doing the past like few years. And I miss you guys. It's just good to see you. But thank you for that. I wanted to ask, is there any other last words that you'd like to share, just as your best tips for wellness before signing off?
I'm I'm really proud of you, Jazel. I think you're doing a great job in helping people become aware and having people educate from different disciplines on the importance of mind and body and wellness, because that does have a lot to do with staying healthy, you know, and just staying healthy, just even mental health, happiness, and as well as physically. And you know, anytime you have questions or you need any help, let me know. And you know, I think it's good just for everyone to just try their best, and that's all you can do. We don't have a lot of control over a lot of things, especially now. Stay healthy, stay away from germs, wash your hands, wear masks, don't go outside. Virus is out there and it's real. So just do what you can for yourself, and stay healthy, and And I wish everyone health and safety.
Thank you. I really appreciate your kind words and your time just meeting with me and sharing about your practice. It really means a lot, and I just absolutely love like everything that you're doing to keep people healthy as well, and just really just honestly caring about people out there. And they're very lucky to have you as a physical therapist who really does care about them, like not just like to improve like themselves physically, but really just caring about them as a whole person, knowing that like, you know, they their their mind and body are all in one, but you know, you really have to genuinely care for them as a person, and giving that care has healing powers of its own, essentially. So I'm very grateful to have you on here, and thank you so much for the work that you do and for your time today.
Oh, thank you. Miss you.
Miss you too. Bye.
Bye.
Take care.
You too.